Everyone, hello. I am Arvind. I'm currently doing internal medicine at UCSF in San Francisco. And so at this year's conference, I'm doing poster presentation. I'm interested in looking at the outcomes after upfront autologous stem cell transplantation for individuals under the age of 40. And in that population in particular, we don't really have a lot of evidence to actually guide what to do in terms of treatment after upfront autologous stem cell transplant, especially because in that population, they often end up staying on treatment for longer. And we need to know some more information about how to balance the toxicities of the treatment with trying to improve their outcome and their survival as well. And so in this study, we ended up actually seeing patients who got an upfront autologous stem cell transplant between the years of 2004 to 2024. Out of all the patients at our center that ended up receiving the transplant, there were about 54 patients that ended up receiving a transplant under the age of 40. In that population, we found that after about 6 years of follow-up, that their time until the disease came back was about slightly under 5 years at 53 months. And in terms of their survival overall, the estimated 5-year survival was actually quite high at 85% in this population. And so I think in terms of thinking about what in this population makes someone more apt to do well after upfront autologous stem cell transplantation, I think we found that it was the depth of their response after transplant, as well as how many treatments they were on afterward that impacted their outcome. So for instance, thinking about maintenance therapy in this cohort, we found that for patients who were on 2 or more drugs compared to just 1 drug after transplant, that their outcome was actually improved in comparison to patients that were just on a single drug. I think in addition to that, the other thing we also found was that in terms of thinking about how long people were on for maintenance therapy after transplant, we actually found that the overall duration of their maintenance therapy did not have that strong of an effect on their outcome overall. So I think in terms of thinking about what this means for the future of patients, I think the first thing to note is I think we do need more data in this group to understand how long someone who gets an upfront autologous stem cell transplant when they're young actually needs to stay on treatment. We actually found that among patients who tended to survive for about 100 or so months after transplant, that they actually did extremely well. And so there could be some additional data in this group to say that after a certain amount of more intensive upfront treatment, that you could actually stop and kind of see how they're doing. I think in addition to that, we think we do need more data to understand kind of exactly why patients who are younger actually get disease in the first place, because I think there have been some studies to look at whether these patients have a strong family history or if there's anything else going on. In our study, because it was small, we didn't see really any trends in this population, but I think in the future it'll be interesting to also see that as well.